From the JAMA Network, this is JAMA Internal Medicine Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinions featured in JAMA Internal Medicine.
Hello and welcome to our listeners around the world. This is Dr. Eve Rittenberg, and you're listening to JAMA Internal Medicine Author Interviews. Thanks for joining us. Today we're talking about a study that successfully uses peer mentorship and support to maintain weight loss. Weight loss maintenance is just a huge challenge. There are many ways to help people lose weight. There are effective lifestyle, medication, surgical treatments, but we don't know a lot about how to keep that weight off for the long term in a sustainable and affordable way. And so I'm really looking forward to talking with our guests today. Professor Tricia Leahey is a professor in the Department of Allied Health Sciences at the University of Connecticut and director of the Institute for Collaboration for Health Intervention and Policy at UConn. She authored a study in this week's issue of JAMA Internal Medicine evaluating patient-delivered care for weight loss maintenance. So welcome, Professor Leahey.
Thank you very much. I'm delighted to be here.
And Professor Kathryn Ross is a senior scientist at the Advocate Aurora Research Institute, and she's faculty at Wake Forest University School of Medicine. She authored a commentary about the exciting implications of Professor Leahey's study. So welcome, Professor Ross.
Thanks for having me.
Okay, so let's start with Professor Leahey. So Tricia, what made you interested in patient-led interventions for weight maintenance in the first place?
So two things are happening simultaneously in our research. One is we were conducting relatively shorter term weight loss trials and achieving clinically meaningful weight losses through a variety of different types of lifestyle interventions. But then it started to unravel at about 6 to 9 months of treatment. And so we were seeing what we've consistently seen throughout the literature is that weight loss maintenance is very difficult to achieve and sustain long term. And the other thing that was happening is our group was studying the effects of social processes on health behaviors and learning that social processes can be both positive and that they can have a lot of positive and beneficial effects for our health behaviors and negative. And we thought, is there a way to harness social processes such that we can have positive effects on health behaviors over the long term? And while we know we can do this professionally, can our friends, our family members, can people that we're introduced to who have similar interests do this for one another over the long term within and creating social networks essentially for long-term health behavior change?
And were there things that made you think that was possible? Like, why would social networks be helpful? I mean, I think sometimes, as you said, there's a lot of negative peer influence too, like, oh, let's go to this birthday party and have some cake or whatever it is. What made you think that it would work to maintain healthy lifestyle changes or weight maintenance?
Yeah, so we started to do some studies to look at the effects of social norms and social comparisons. And we found some of the negative effects and that, social norms can unravel health behaviors in terms of social pressure or expectations in certain social networks regarding maybe being more sedentary or eating foods that are inconsistent with goals. We also saw the opposite, and that being around people who are really focused on physical activity, who are really focused on healthy eating, can have a beneficial, positive social influence on our participants in some of our studies. And so that led us to believe, well, what if we created positive social networks or social networks with good beneficial influence around individuals who are trying to maintain health behavior change?
Tell us what you did for this study. How did that intervention shape up and what did you find?
For this particular study that's being reported in JAMA Internal Medicine, what we did is what's called a 2-phase weight loss maintenance design. And essentially, the first phase focuses on weight loss, so inducing weight loss. And then the second phase is the actual weight loss maintenance trial. And so during the first phase, everybody received an evidence-based weight loss lifestyle intervention for weight loss. That's based on the Diabetes Prevention Program. And it's a 4-month, 16-week intervention. So folks who achieved a 5% weight loss during that first phase or the initial weight loss phase were then eligible for the actual randomized trial, which was focused on weight loss maintenance. And so individuals who achieved the 5% weight loss were then randomized into one of the two interventions, either the peer support intervention, which is what I'll talk about more in just a minute, or what we know as standard of care, which is ongoing continuous care from a professional that provides support, education, and accountability to help people maintain successful weight loss.
And so, can you tell us what you found in your study?
Sure. So, individuals who are randomized to the peer to peer intervention, which involved ongoing peer support and was delivered by successful weight losers and peer support provided by fellow participants, actually maintained significantly more weight loss than individuals randomly assigned to standard of care.
So, that's really exciting that this potentially more cost effective, lower intensity in some way treatment was more effective than standard of care. And I'm wondering if we could bring in Professor Ross now to comment a little bit about that. Like, what do you think made that patient led treatment so successful?
Sure, I'm happy to hop in. Well, first off, I do want to agree that that was the really exciting part of this study. And I want to highlight for the folks listening that it's not that the standard of care did worse in this study than what we see in other trials. The standard of care lost and maintained similar levels of weight to what we saw in our previous literature. So, about what we'd expect. So, it's not that standard of care in this trial was maybe not doing as well. And so we beat it, or Dr. Leahey's team beat it. But this new intervention actually really did do better than our best intervention that we've had. And in doing that, I think one of the really interesting things, this is more cost effective, but one of the strategies in this intervention that I think might be particularly important going forward for our field is just the amount of contact and amount of support that can be offered. So in our gold standard programs, we can typically only check in with folks once a month. And even that is enough to where we create programs that are unsustainable and can't be disseminated, because asking a provider to check in with folks once a month still is a lot of time and quickly becomes a caseload that's unmanageable when you have people staying in programs for longer and longer. And so having this peer support model really allows for folks to be able to interact when they need it, when they need that support, not that once a month that who knows how folks are doing at that given time. They could be doing just fine. They could have run into problems 3 weeks ago, but nobody was talking to them then. So you're able to chat with people in more of a real-time scenario, which I think can really help folks stay on track. But importantly, with this idea around maintenance, not necessarily being something where someone just stays at the same weight all the time, but we're seeing this model now of success might be continually re-engaging folks. So experiencing a little bit of regain, but stepping back in and getting back on track right away. And I think this sort of model supports that really well because it helps people see when difficulty is starting to arise and help get back on track right away.
And, it's so interesting as we think about the sustainability, particularly with the new medication treatments. How do you continue that in a way that is feasible for so many people? And so it's really interesting to me to see this model that you're talking about. I'm wondering if either of you has thoughts about what comes next in this field in terms of how do you build on this type of intervention, or what do you think you want to see happen next?
Our team has a few ideas that we're interested in pursuing. So, of course, one step as we see it is thinking about which intervention components could be most expensive. And to that end, which of them are also contributing to weight outcomes. So, are they cost effective, basically? And so we could do a study in which we look at the effects of the different components that we tested as part of the whole peer package to see which components of the intervention are driving outcomes and what's the cost of those components to see which one should move forward towards dissemination.
Which do you think would be interesting to look at?
So in the peer support arm, folks got access to group behavioral weight loss treatment. It was delivered entirely by individuals who have successfully lost weight by peers. But do we even need that? Is group treatment necessary? Because there is, if we choose to compensate mentors, or as we call them in the study, so successful weight losers, do we need that component such that we wouldn't need mentors or their compensation? And perhaps this could even be a more stealth intervention if we were to deliver it in bariatric care clinics, or if we were to deliver it as part of a YMCA after care intervention following a DPP program. So thinking about those components that perhaps we can make even more cost effective and develop an even leaner intervention that remains powerful could be very interesting. And I think to Kat's point, one of the beautiful things about this peer support treatment is that individuals can get support when they need it because they're connecting with somebody in real time and organically in real life. And so perhaps there's a party coming up, or perhaps they're going out to brunch, or they didn't get in their exercise routine and they could use a little pep talk or whatever it might be. You can't really do that with a professional and dial them up when you need them, so to speak. But you can do that with your social network and your healthy social network. So I think there could be research studies that look at newer intervention methodologies like just-in-time adaptive interventions to see if we are to deliver this peer support exactly when needed, does that make it even more powerful? And can we even improve weight loss maintenance outcomes further? So those are a few different dissemination and kind of cost effectiveness and impact areas that we're thinking about next.
And do you think that these kind of interventions are specifically effective for weight loss maintenance, or is there something about it that is more broadly applicable? My understanding is that some of the interventions in other fields have had somewhat more mixed effectiveness. Is there something about weight loss that's particularly attuned to this strategy?
I think that's an interesting question, and perhaps it depends, and I'll be curious to hear Kat's thoughts on this too. It might depend a little bit on the health behavior. A lot of weight management is very social. It's often pretty acceptable to talk about weight management, healthy eating, and physical activity. And I think that sort of social piece, as it relates to those aspects, lends itself to developing a peer-based weight management intervention, whereas there are other health behaviors that maybe have more stigma attached to them, like smoking cessation, or are kind of more secretive, so to speak, or some addiction. And, so I think that there are things about weight management that lend itself to more social ties and support.
Yeah, and I can follow up on that as well. I think, too, what might matter both within and across fields is also how we are training folks in these interventions. So earlier, Tricia was mentioning components that might be helpful or not helpful, and do we need group sessions, that sort of thing. One thing that I thought was interesting was how they trained the peers in this study, at least how it was described. And a lot of what we describe in trial papers versus what we do, not all the details are always there. So I'd be curious to learn more, but I do wonder if there's something there too to how the peers were trained. Because if you look back in our field, some time ago, there was work on peer interventions that did not go so well. I'm thinking of one of Mike Perry's earlier studies on maintenance. And I remember talking with him at one point, he was mentioning that he tried to have peer groups on that same once a month schedule that we would typically have, and found that they kind of went off the rails without having that oversight as you would have in your study, Tricia, with the mentors checking in to make sure things were going the way they were supposed to go, that peers are providing support in the right way. So I almost wonder if there is something special about having that mentor framework and it not just being a kind of, you guys are supporting each other, good luck type intervention. And I wonder too, across fields, how much that has varied across all these different studies.
I think that's a really good point, Kat. And I think to expand on that a little bit is we were very intentional with our training of both our mentors and our peers. 3 different trials had preceded this trial in which we kind of tweaked and refined how we trained our peers and our mentors. So we were very intentional in that process. And we really focused on what we knew worked in terms of evidence-based social support. We also really focused on relationship development among peer dyads. And it's a lot easier to connect with somebody when you feel like you know them a little bit, and maybe you have some things in common with that individual, than it is just a perfect stranger. So we definitely harness the social processes that we know create influence based on the literature to try to create powerful peer dyads to support each other through this. So I do think that the way in which we were able to bring peers together and how intentional we were about their trainings could have improved outcomes.
This is so interesting in so many ways. I really appreciate both of you coming here to talk with us about this today. I'm Dr. Eve Rittenberg, and I've been speaking with Professor Tricia Leahey and Professor Kathryn Ross about peer-led interventions for weight loss maintenance. You can find a link to the articles we discussed in this episode's description. This episode was produced by Daniel Musisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.